everyone, my name is Kelly Williams. I'm a registered nurse in the JHH Adult Emergency Department. I'd like to introduce Alex Johnson from the Center for Nursing Inquiry, and she will be presenting I Have an Idea, Now What?
Thank you, Kelly. I'm very excited to be here for the 2021 Shine Conference.
All right, Alex. So I'm at the bedside and I identify a gap in practice or a potential patient safety problem. I think there's a better way to do something. What should I do next?
Turn to the evidence and find out. So the first step in any inquiry project should be to review, analyze, and synthesize the latest scientific evidence. This process is also known as evidence-based practice. You want to know, is there good, consistent evidence to support implementing a certain practice change, or is there little, inconsistent evidence that suggests further research is needed?
Say I've noticed an increase in CLABSI rates on my unit, and I want to know the best practices for central line maintenance. Where do I start?
So when conducting an EVP project, it's important to use a model to help guide your work. Here in the Johns Hopkins Health System, we use the Johns Hopkins Evidence-Based Practice model. It's a three-phased approach referred to as the PEP process, which stands for Practice, Question, Evidence, and Translation. In the first phase of this process, the team develops a PICO question by identifying the patient population, interventions, and outcomes. In the second phase, research is performed and the evidence is appraised for strength and quality. And then finally, the findings from that literature search are synthesized to develop recommendations for practice. The Johns Hopkins Evidence-Based Practice model is also accompanied with some user-friendly tools. These help you walk through each phase of the project.
What if I need help conducting my EVP project?
So there are a variety of resources to support nurses conducting EVP projects. One here at Hopkins is an online training in My Learning. Johns Hopkins nurses have free access to this course, and it walks you through the EVP process from beginning to end and provides guidance to the learner on how to use these EVP tools. And then the Center for Nursing Inquiry, which is where I work, is another excellent resource for EVP projects. We have an EVP program coordinator named Maddie Whalen, and any of the other inquiry coordinators, including myself, we can help answer any question you might have about EVP. And then on our website, we also have an inquiry toolkit that has all 10 of the Johns Hopkins EVP tools to help you walk you through the projects. And then finally, one of the big ones is the Welsh Library. The Welsh Medical Library serves the faculty and staff of the Johns Hopkins Medicine, Nursing, and Public Health. Sometimes one of the hardest parts about conducting the EVP project is actually finding the evidence in the literature. The Welsh Medical Library has informationists assigned to each department and hospital within the health system to help you with your literature search. They can help you develop search terms and keywords, choose the appropriate databases to search. They can even help you develop your question. So they're a great resource to help you get started and ensure that you have a comprehensive literature search.
That's really helpful. So I've conducted my EVP project, and now I found really good, consistent evidence to support implementing K cards. What should I do next?
So next step is conducting a quality improvement project. So a quality improvement is a process used to assess the implementation of an existing evidence-based practice. Practice changes are first implemented on a small scale, and then if they're successful, typically rolled out system-wide. The whole goal of a quality improvement project is to improve how things are done within an organization by using an existing evidence-based practice. Similar to EVP, when conducting a QI project, you want to use a model to help guide your project and give you feedback on how you're doing. The model for improvement is one of the most commonly used QI approaches in healthcare. It's often referred to as the PDSA cycle, as that is the second phase of the model. In the first phase, team members are going to ask themselves 3 questions to help set aims and goals of the project, establish how they're going to measure if the change they're implementing is effective, and then they're going to select a change that is believed to result in an improvement. Those 3 questions don't have to be asked in any specific order. They just need to be asked before moving into the next phase of the project, which is the PDSA cycle, which stands for Plan, Do, Study, Act. And oftentimes PDSA cycles occur rapidly, and many cycles can be completed for one project.
Okay, so what if I need help conducting my QI project?
So just like EBP, there are a ton of resources to nurses here at Johns Hopkins to help them walk them through the QI process. One of the big ones is the Armstrong Institute for Patient Safety and Quality. They offer free courses to Johns Hopkins nurses interested in learning more about QI models and tools. They will help you learn in detail about the model for improvement, but you can also learn about Lean and Six Sigma models, which are other commonly used QI models in healthcare. And again, the Center for Nursing Inquiry is here to help you with any QI project that you're working on. We can help you select appropriate models, metrics, implementation strategies. And then we also have a bunch of tools on our website in the inquiry toolkit that list such as like the fishbone diagram, driver diagram, failure modes, and effect analysis. So if you need templates to help get you started, those are all available for you on our website as well. Another one is the Institutional Review Board. While it is not required to submit your QI project to the Institutional Review Board, it is recommended to submit it for acknowledgement. Getting this acknowledgement for the IRB signifies that your project was well thought out and it will be executed in a manner that is ethical and respects the rights and welfare of human participants. To help walk you through this process, the IRB has tutorials on their website to get your project submitted for acknowledgement. And then finally, another great resource is the Institute for Healthcare Improvement. They are the leading authority on QI, and they have tons of tutorials and tools and videos on their website to answer any question you might have about quality improvement work.
So what happens if I conduct my EBP project and find no evidence, weak, conflicting, or incomplete evidence? I can't implement this practice change. What do I do now?
So this is where you would conduct a research project. Research is a systematic process to develop new knowledge. It requires approval by the IRB because you are generalizing new knowledge beyond the usual patient care. Doing this can impose additional risks and burdens on the patients. So informed consent is also required when conducting a research project. If a subject or patient is participating in this project, they have the ethical right to not participate or to decide if they want to participate. Nurses can be involved in research in 2 ways, as either a co-investigator or a principal investigator. A co-investigator is someone who assists the principal investigator or PI in the management of a research project. There can be any number of co-investigators supporting the PI from nurses and doctors, any one of the team members. And then the principal investigator is the person that is in charge of the research project. They are responsible for creating the study protocol, ensuring that the study protocol is followed, analyzing study data, and reporting the study findings. If any nurse wants to be a PI or a co-I in a research study, they need to complete IRB compliance training before the project gets started. Information about all of that training can be found on the IRB's website. If a nurse wants to be a PI, there are some additional requirements that they must fulfill as well. Those include that they have to be master's or doctoral prepared. They need at least 1 year of non-trainee work experience. They need a letter of endorsement from the director of nursing, and they need to have participated in at least one other IRB approved human subject study research as a co-investigator.
Oh my goodness, the research process sounds intimidating. Who can I turn to get my research project off the ground?
So it can sound daunting, but please know there are tons of resources available to nurses, especially here at Johns Hopkins. As always, the Center for Nursing Inquiry is here to help. If you need help creating your research question or finding proper data management plans, statistical analyses plans. We can even read your study protocol, and those tend to be pages upon pages, and you want a second set of eyes to look at it, because sometimes you get too into the weeds. So any of those things, we are here to help you with your research project. And then we also have some of the more commonly used tools on our website as well in that inquiry toolkit. So if you need to learn how to get access to a safe desktop, which is a program that ensures that all of your study data is safely and properly stored, or if you need to use Qualtrics, which is a tool to help you survey people, all of those things you can access from our website. And then the IRB is going to be a big one here. Since you have to submit research projects to the IRB before you get started, the IRB has tutorials to guide you and any other study team members through submitting your application for your research project. And then they also have some templates on their website for commonly used research forms, such as informed consent and HIPAA authorization forms. And then finally, the Institute for Clinical Translational Research is a great resource. It's a National Institute of Health supported center, and they provide tons of consultation services to Hopkins researchers. So if you need help with biostatistics consulting, study design, ethics consulting, they are here to help, and they're a great resource to turn to.
Alex, thank you so much for all of that information. If any of you watching are interested in learning more about the life of a project, check out the other videos in our on-demand library. You can learn how to submit a project to the IRB, how to prepare a manuscript for publication, or how to critically appraise research articles.
Thank you, Kelly. It was so great to be here, and thank you everyone for watching. Have a great day.